question, and I noticed a couple of people had asked questions around women's health, adolescent and children's health. Do you have any comments to make about the work that you're focusing on there in that area? And the Women's Health Panel was asked about.
Yes, the Women's Health Panel at Davos was framed as the economics of women's health. It was really making the case, for governments to invest in women's health. Girls and women's health is so critical, and is often a neglected area, as we saw during the pandemic, when sexual and reproductive health services often failed to be delivered as they should have been. I think this week there was a report to come out from WHO around maternal death rates and trying to get some handle on what happened during the pandemic, but they will have gone up because there was a lack of access to safe birthing, to contraception, to safe abortion where it had been available, and so on. So investing in sexual and reproductive health services, which always get through, which are regarded as part of the essential package of health services, is pretty critical. For the Partnership for Maternal, Newborn and Child Health, which I chair, this is quite a big year for discussion and getting commitments on adolescent health and wellbeing. There's a process running, a campaign around it, which I sometimes putting up there, publicity on Instagram and Facebook story. It's called 1.8, hashtag 1.8. It's referring to the 1.8 billion adolescents and youth in the world today and the issues that they face, and giving a platform for them to have voice about them. Issues ranging from mental health, access to sexual and reproductive health and rights, to health services generally, to the things that contribute to well-being. Young people are very exercised about the climate crisis, for example. This will culminate in a global meeting, which will be largely online around October. So, watch the space, and if you go to PMNCH on the website or Twitter or Facebook, you'll see more about what they're doing on that.
Right, and sort of linking into that, and just very, very quickly, because I see we're nearly out of time, but Lisa also asked your main thoughts on health equity for women and children's health in Aotearoa. Do you see those being sort of, what are the main issues here compared to internationally?
Well, I think we've done well with, free access to services, birthing, pregnancy, birthing, immediate aftermath, child health services free at GPs. But I think for us, we need to look at social determinants. And social determinants affecting a child's health, of course, are around housing, nutrition for low-income families, in particular, the ability to have the level of income for a child to thrive. It's always disturbing to see the numbers of children in New Zealand who live in families which, relative to the mean or the average in New Zealand, are living in poverty. So those are the social determinants that need to be addressed for all the children in New Zealand to thrive.